Good afternoon, everybody.
Hey, good afternoon.
How's it going? Where are you at? You don't have a camera?
What happened? I don't know why it's not.
You have to click on your
Video.
the video thing for you to.
Oh, start video. Here we go.
There we go.
There we go, guys.
Well, what are you doing?
Hawaii.
Yes.
Nice, I like
Hey,
it.
what's up? Nice seeing you, man.
How's it going?
Hey, man.
It's good to see some familiar faces here.
Yeah.
What's going on? Tell me.
All right. Well, let's see. Should we start right away? You want to do some warm-ups before we start, or what?
Doesn't matter. Ready, man. Ready to go.
He's warmed up at the beach. It's warm.
Yes,
You're ready to go swimming, is what it is.
Yes. I'm sorry. I'm calling you from Hawaii, but what's going on?
Let's do this. Let's get first of all, thank you guys for coming today. I know it's a short notice. We only talked about it for a few days, but I appreciate you guys taking the time from your busy schedules to be on here and to help in the community.
Oh, for sure. Thank you for having us, guys.
Do you want to start by just introducing yourselves, and how long you've been in the profession, what hospital, what office you work at?
Well, my name is Dr. Mallouk. I work for Anod Agdan Hospital, so I've been working for more than 6 years. And I do family practice. I also do like inpatient hospitalist as well, and pediatrician as well, pediatric medicine as well.
I'm Dr. Sharma, Amit Sharma, and I'm a colleague of Dr. Mallouk. I've been with ARNET for almost 3 years now, 3 years in September. I'm family practice physician, and I do some dermatology.
Okay. So let's start by, do you guys have any information you'd like to share before we get to the questions and stuff like that, about the area and how it was affected with COVID-19?
You want to go ahead, Dr. Sharma?
So, here in I'm going to extend and call it the twin tiers, Southern Tier of New York and Northern Tier of Pennsylvania. We've been pretty well protected in terms of cases. At least in the hospital, there's been a few cases. And as a whole, our community has been protected. We've had several cases, but we didn't have the surge that we were expecting and hoping for. So hopefully, let's keep it that way. If people keep with the social distancing, hand hygiene, and limit the travel, so we're nowhere near cases like downstate or New York City. So.
Yeah, I agree with them. Definitely COVID-19 did affect us economically and also with regard family, like gathering with family as well, all the distancing, all with the protections and all that stuff. Hopefully, but so far, as Dr. Sharma is, I do have the census from Mallouk and Steuben as of today. In Mallouk, we had like about 109 cases, 103 recovered, and only 3 deaths. Okay, and for Steuben County, 260 had COVID-19, and 180 recovered, and 41 deaths. And you wonder why Steuben was more, and that's because it reflects that most of the deaths it's from nursing homes. And as we know, COVID-19 does affect people over 80 and people who have underlying problem like diabetes, like kidney disease, or immunocompromised, definitely, and it gets them very bad. And unfortunately, we had a few more in Steuben than Mallouk.
Okay. So as far as the phases that have been rolling out from the governor, I'm not sure if everybody understands exactly how that goes. You guys get notes and stuff like that and information every day about it. Where are we as far as that goes?
Yeah, definitely, definitely. I think we are getting into phase 2. In phase 1, we were not able to see patients. Everything was via telemedicine or via telephone to talk to patients. Now we're in second phase, was phase 2, We see every patient every half hour, and definitely keeping also the distance, very important, 6 feet. So patient will come and they have to call, and then we want to make sure that nobody, we don't have too many crowd in waiting room. And have good.
Oh, I just lost you, I think.
I will face to your doctor. We're taking precautions. Everyone entering the building gets their temperature checked, and if they have symptoms of COVID or a fever, then they are not allowed in the building. So we recommend just have one person come in. So if you're a baby with a mom and dad, we recommend just one parent. The other can be on video. And it's very limited how many people can come in the waiting room. Okay, so it's safe. All the rooms get cleaned before and after. So and elective surgeries have opened up, meaning things that are that it's not emergencies. They can wait. Those people get tested for COVID before the surgery. They're not they have COVID, so it's safe to go have those surgeries. And then in terms for everyone else, phase 2 means that malls can be open. The Arnott Mall has opened now. Some dine-in places, they're open to gathering of people. Some gyms, exercise classes, movie theaters, these are all in the phase 2.
Yeah. And at the same time, we have to be really stay educated that if someone having like fever, which is the most common finding in COVID-19, if somebody has symptoms like fever or cough, especially dry cough or shortness of breath, definitely please make sure you're wearing a mask, make sure you call the emergency room or the hotline, and please tell them, and they will screen you if you do have, how risky are you, and then we'll tell you exactly where to go. Those are the most common. Fever is number 1, and after that there is a cough, and then shortness of breath. Those are the 3 you have to keep in mind. Of course, if you are asthmatic, you may have shortness of breath. Definitely, that's your baseline, it's not a problem. But if you all of a sudden have fever, please make sure you put a mask. Make sure to protect yourself and protect others as well.
We had somebody that asked a question about wearing masks outside. Do they have to wear them when they're even when there's nobody around outside? Do they have to wear them only when they're in a crowded space? Because there's been some confusion at one point whether we should wear it when we're just inside the stores, or should we wear it outside when we're hiking too? Just a clarification as far as that goes.
Well, the virus is spread by droplets. Okay, so when you cough or you sneeze, it may fall. It may. That's why we are saying 6 feet. If hopefully it falls on the ground, it lasts for 1 hour to 4 minutes to hours, and it dies. And when you're home, you really don't have to wear the mask. You really don't have to. But in public, I think you should, because you are protecting yourself and protecting them from you as well. Because when you cough and somebody puts your hand, you cough and there is droplets on the chair, somebody put their hand on the chair, yeah, that person will get the virus, and it will have some issues. So definitely mask must, in my opinion. And I think it has been working. Like at the hospital, I think distancing and mask work, in my opinion.
So yes, the mask in public place, when you're out in the public and you can't maintain that distance at 6 feet. So there's a lot of gray zone. People have the mask on, they go outside and they take it off, and then they come in contact with other people. So if you're just by yourself, you're walking, hiking, no one's there, sure, you can, take it off or put it. And very important, when you take the mask off, have a paper bag, put it in a paper bag. That way, people leave it on tables, they'll hang it in their car. So the mask, it protects you and it protects others. So the inside of the mask is clean. So the moment you put it out somewhere else, it can get dirty and you put that back on. So you do want to protect the mask when you're not wearing it. And if you have a cloth mask, wash it after the day's use.
Yeah, and make sure you wash your hand, wash with soap for 20 seconds, and or use any alcohol-based solutions, at least 60% alcohol in it. And those are the things that you have always to remind yourself. Sometimes you can, we have tendency to touch your nose, this is a habit. Always wash your hand. If you don't know what's 20 seconds, then maybe you can, there's somebody may say you may sing a happy birthday twice, and that's 20 seconds, so yeah. The reason is this COVID-19, we don't have too much information about this virus. We know that coronavirus exists in the past. There is like a lot of them, and the animals are the host, they host this virus, but this one is unique compared to SARS or MERS. So this is the latest one. We don't know how long it's gonna last. It may decrease during during the summer season. We don't know yet. So they always have to be careful.
Just to clarify, so if you're outside, as long as there's not, if let's say you're in a place where you're not indoors, not in a store or anything like that, you're outside, let's say in the park, and there's people around, but further out, not close to you, can you take the mask off and spend time with your family? Do you have to keep it on the whole time? Because a lot of the confusion was, if we're not indoor, can we, if there's nobody around, can we take it off or just take it down without having it on?
Okay, you're jogging, you're far from home.
Can you hear me?
Optional, you can keep it or take it off. I don't see the issue there. However, if you feel you have symptoms, you feel like you're sick, definitely you should be having it on all the time.
Okay. Mike, did you have a question for the doctor?
Do you agree, Dr. Sharma, with this?
Oh.
Yes, yeah.
Hold on. I think it's really...
My whole family in the house that I'm in, we had symptoms back in December before all this even happened. Is there a chance that we got hit with COVID back then? Or is that just a different kind of flu that was going on?
It's possibly. And the only way you could tell if you had the virus, you have to do a serology to check antibody that you had it before. I'll give you one example. My niece who lives in Spain, in December she tastes, and maybe you have some zinc deficiency, go see your doctor. And she has kids and her husband, everything. 3 months later, last week, she has to go back to work. But at her company, they have to check everybody before coming to work. Well, she tests positive for IgG that she did have the virus, and she didn't even know about it. She was asymptomatic. So the good news, that's her family, probably they're exposed and they're okay. The bad news, nobody was sick from it, like it was not. So the whole family has to go be tested. So far, there are 2 tests that exist. There is the serology one, which is the check for IgG if you had it. Definitely you can ask your doctor to do it. Ideally, I've seen many patients come and ask me and I do it. The other one is to check if you have the antigens, which is PCR, polymerase chain reactions. They check for the antigen of the virus. That one as well is available if you have symptoms. I want not to go to them and say, okay, can I have to check for COVID? So far, we do it only for the patient who are getting elective surgeries. That we want to make sure if they're going to the hospital, they're more likely you have to quarantine yourself for at least 14 days and be checked twice. It has to be negative before you be free. Some companies require that if you are positive for COVID-19. I had a couple of patients who were positive. I didn't do anything for them. I just told them stay home for 14 days, and that's it. They both, husband and wife, both survived it. After that, we did the test and was negative, and he went back to work. and he can be in public just like anybody else because he's passed. But there is some criteria, and CDC tells you, how do you know you are free of the virus? Well, one of them, you shouldn't have fever. You shouldn't have any shortness of breath. You shouldn't have chest tightness or any cough. Then you are more likely free of the virus. You know, you're not transmitting it to other people. It's just like having a flu. When you have a flu, you have like 3 days, you pay the price, then you are immune. You cannot give it to somebody if you are healthy. But if you are sick during that period of the virus and you go out, yeah, other people can get it. Yes, correct. I mean, coronavirus has been there for years and years and years. It's not something new. But the last few, like SARS, which stands for severe acute respiratory syndrome, it's also part of coronavirus. It's a group. It's a beta group. There is another one, MERS, which is Middle East respiratory syndrome as well. That was found in Middle East, in Saudi Arabia. And it came from people either in contact with camels or ate camels meat. That's how it spread. But for this virus we have now, the one that's COVID-19, we don't know much about it. We know that it is a group beta of coronavirus. There are like four types: alpha, beta, the gamma, and delta. And the alpha and beta are the one that's most viruses causing problem. There is at least 7 viruses that now from beta or alpha that's causing symptoms, from croup to common flu, like to SARS, to MERS. Now we have this COVID-19. So this all can cause problems. Most of them cause respiratory problems most of the time. And people like COPD, smokers, people who have the asthma, the elderly, this will pay the price more. So the more gonna, they're gonna suffer from the virus.
Yeah, just to reiterate, Mike, that's very possible that you may have been exposed to in December. I had a patient ask me same question, and he had a family member who was very sick in the winter, and they had traveled to Texas and came back, and they themselves had very similar flu-like symptoms, not as severe, but their family member was really sick, and when tested now was positive for corona. So certainly possible, and the way to tell would be through the antibody test.
Okay.
Okay, so I had another question that came in about judging by our cases here in the area. Do you think it is too soon to open all the businesses or most of the businesses, especially because we don't have any clue when vaccines are going to be available or anything like that? What do you think about that? Do you think it's that we're moving too fast, or is it something that we should slow down more until we know more about the virus itself?
So we have to have a nice balance. Here, corona is, not just a health concern, but also an economic concern. And in our area, we have been pretty well protected in the sense that we don't have the same numbers as New York City, but it's still personal. When you had a family member that has a close friend, I had one of my friend's dad, he passed away from corona, very healthy, and all of a sudden had corona and passed away. So, that makes it difficult. But having said that, I think we do need to get things back. If you have symptoms anytime, like the symptoms that Mallouk talked about, loss of taste, smell, non-specific symptoms like GI, stomach problems. If you have any of those, then you stay home. You let your employer know, let your boss know you stay home. So yes, I think we can open things back up, and we should, but with safety in mind. If you do all those things, and as the governor's doing, if the cases go up, then we back down. But I think we are getting ready as things are getting warmer and more people are outside, those safety precautions are coming down. So want to keep that in mind. If you're going outside in public, wear your mask, carry a hand sanitizer with you, those small bottles. Anytime, you touch surface, wash your hands, and maintain your distance.
Definitely, there is protocol by CDC, like what Dr. Sharma said, and by the governor, and we're following these protocols. And I think so far they are working good. Are we ready to open? Yeah, we have to open someday. And whatever Dr. Sharma, I agree with him 100%. We just have to follow the protocol very carefully. Stay, wash your hands, and masks, and hope for the best. Until we get the vaccines for it, which is possibly by by December. That's what they are shooting
Yeah,
for.
I was going to ask about that. Is that something that's realistic? I know that they said before, like a couple months ago, they said it could take 1 to 2 years for us to actually have a vaccine that's tested and ready to go. But 2 weeks ago, I think about 2 weeks ago, they again said that by the end of the year, we should have one. Do you think that's something that it's a realistic way, or is it something that's just a political stunt? What do you think is happening there?
Well, in order to come up with the vaccine based on the past, each vaccine takes about like up to 10 years or even more to get a vaccine, because it goes through some phases, phase 1, phase 2, phase 3, they try it on animals, then go for human, and little by little. So this vaccine is going fast because we start with human. So patients.
My connection is crazy.
Experimental. It has not to be. Nobody knows, because the vaccine will be there, but we don't know what will be the side effects in the future for kids and for other people. That's my concern. So, nobody knows. Okay.
Do you think vaccines going to become mandatory?
I don't think so. I don't think it's just like the flu vaccine. The flu vaccine for healthcare, have to have it, or October till May. So I don't think it's going to be mandatory for everybody to have it. No. Like some kids were not vaccinated, and I don't think it's going to be mandatory, in my opinion. What do you think, Dr. Sharma?
Yeah, no, I don't think we can make this mandatory. It would be, first we have to get the vaccine, then establish the safety of the vaccine, see how well it works. So all those questions we don't know. And when we do get the vaccine, it's going to be, a question of who's going to have it first, whether the healthcare providers get it first. Even for us, like the flu shot, you have a choice whether you get it or you wear a mask. So it would be the same for the public too, if you don't want the vaccine. And there are going to be people that don't want it. And this being a new vaccine, it's going to be a individual call. And at that point, you maintain your social distancing, hand hygiene, and mask.
Red, you got to unmute yourself.
Okay, can you hear me?
Yeah.
Yeah.
All right. So I know that New York City got hit hard the most in the whole state. Have you guys seen any cases that came from New York City to here? Is that and it got spread more, or is something that wasn't a factor at all when it comes to cases in our area here?
I'm not aware of any. So.
Yeah, personally, I've not seen. I've seen a few cases that were from travel, but not necessarily from New York City. So I don't know myself. You may have to ask other people to get a better idea.
Okay. I had another question that just came in through. Some people are worried. Well, the question was that they're worried about if they keep to each other for too long, wearing the mask and not be involved in a like keep the social distancing and everything and keep the mask on. They're worried that the immune system might get compromised or get weakened by it. Is that something that how would that work? Is there something that could happen, or is it a different situation to it?
Well, the answer is no. I don't think it's going to weaken your immune system. Yeah, because maybe you are saying the kids, like for example, kids are not exposed to things. Well, when they're home, the viruses and bacteria are everywhere. You know, like bacteria, like you touch the table of your house, or even my skin, I touch here, yeah, I have bacteria. So I don't think it's going to be affected much. I don't think so, in my opinion.
Yeah, no, I agree with Dr. Mallouk. Your immune system will not be weakened by wearing a mask. You know, there's no science to back that. You know, your immune system is, if anything, you know, it's developed over time. We get all these vaccines to protect you from deadly viruses. And in this case, wearing a mask is protecting you from getting the coronavirus. So by not wearing a mask, yeah, you know, you have a much higher chance of getting the virus. And once you have the virus, you know, that's affecting your immune system more. So the dangers are a lot more by not wearing a mask than by wearing one.
And definitely, I highly recommend that people should wear masks, you know, like especially in public area, like we discussed earlier, because I've seen some people say, protested, I don't want to wear the mask. Well, you are being protected, but you're affecting, assuming that somebody is infected and you get the virus and take to your grandmother or your family, your kids or something, they get sick. That's what the problem is. It's not, I know if you are healthy, you can fight it, just like the flu. But if you are any underlying conditions, which is most of us have grandfathers, have parents, have uncles. So those are the ones that you're going to take the virus and you're going to kill them if you do that. So always protect, masks, wash your hands, always. Be safe.
So the schools have closed for the rest of the year, and presumably they're going to be closed through the summer. Do you think opening the schools earlier than, or if they opened them earlier than that, do you think there would have been something that would spread the virus more? And also, when do you think will be a good time to open the schools? That way, the virus won't spread as much as it would.
Again, keep in mind that kids can be the victor. If they open the school earlier, as you can say, most of when you get the flu at home, most of them the kids. If it takes one kid at school, be sick, you will spread the disease, and you bring it to home and give it to parents and family and siblings and all that stuff. I think it was wiser not to open it this year. Next year, we'll be prepared for it. I think we didn't know about this virus. In the beginning, everybody was lost. We just know that people are getting sick, people are dying. We didn't know. Now we know we have masks, we have distancing, 6 feet, and we have more information about the virus. So I think we'll do better as we go. I think so. But I think it was a good idea. It's a very good idea not to open the school, in my opinion.
Yeah, it was definitely, good to have the schools closed so far and through the summer. Now the question you're asking, when can we open back up? That I just don't know. I think we have to see how the next few weeks, months go, how the summer, how the number of cases are trending. If things are keeping down, new cases are on the low, then I could see that in the fall we would have some type of hybrid system going on, where schools can open, you still keep your social distancing, hand hygiene, and combination of virtual versus in-person going into the school. Now, how that will be carried out, we have to get some guidance from the governor, and we have to be creative in the fall. So I think it's a little early to answer that question, but we have to see how the next few weeks to months, next few months go.
But definitely we're knowledgeable more about the virus than before. That's the good thing. So we know what's going on. And will it come back again with even worse? Who knows?
Yeah, that was going to be my next question. Because we see the cases go up and down in the whole country, in the whole world at this point. What are the chances, do you think, as professionals, of the virus actually having a second wave worse than the first one in our area?
So, are we going to get a second wave? I don't know, possibly. Certainly in the fall when the weather gets cooler, that's start of flu season. Could we get COVID coming back that time? It's possible. Will it be worse than the first? I don't know. We're certainly more prepared. We'll be more prepared than we were initially. So, we do know more about the virus now than we did before. So even if we getting a second wave, certainly we are more prepared, and we have to keep our safety precautions in mind, with the mask, hand hygiene, keeping the distance. If you have symptoms, you don't go in. And that's why we have the phases right now to see how things go. If the number of cases go up, we go back on the phase. So we're certainly more ready. We will, let's put it this way, we will be more ready in the fall if we do get a second wave.
Yeah, I mean, we may even start getting it every year, just like the flu, possibly. We don't really know much about the virus. We really don't. We don't know if people who really get COVID-19, if they get it again, will they get sicker? We don't know about the virus. All we know is a virus is an RNA virus, is coded, and if there is mutations, that will change the whole formula. It's just like the flu. If I get the flu this year, I have antibodies for the flu for this year. Next year, if I get it again, I'm still gonna get sick because I'm not carrying the same antibodies to fight the other flu. So we don't know, really, we don't know much about it. Hopefully it happens and it disappears. We know for a fact that Brazil now, they have winter and they have bad cases there now. Earlier, they didn't have it because they had summer. Now they have fall, winter, they're paying the price. You know what I mean? So we don't know, really don't know where the curve gonna take us to. But definitely we're prepared. We're prepared better than before.
Do you think if it becomes flu-like, like it comes in, it comes back every year, do you think that will change how it interacts for a long time, like for years to come? Especially now that, like you guys said that every time we go out now we have to have a mask. Granted, we don't know a lot about the virus itself. We don't have a vaccine yet and all that stuff. But do you think this is our new normal as far as interacting with people outside of our house?
Certainly, we're going to have, so it's going to be tough to have a normal pre-COVID. Going forward, it's going to be a new sense of normal with keeping the precautions in mind. We'll have to have a mask, some type of mask. As we go through the different phases, we'll get more and more relaxed. But to truly go to a pre-COVID normalcy, I don't see that happening till we get a vaccine and till things go back to normal. So going into the fall, keep with the precautions. We're still going to be having some type of mask. Certainly things will be more relaxed. More people maybe go, but it's going to be a while before we go back to what we define as normal.
And they are also working on some treatments as well for the virus. I think so far they have remdesivir, which was for Ebola virus. Now they are using it for the treatment for COVID-19, and it's showing good results. So let's see when that comes as well. Maybe that will help as well. If somebody has it, you get this antivirus medication and it'll be better. I mean, we do have it for flu. It's shortened the durations of the flu, and people do better. And it's also, we use it as prophylaxis for people not to get the virus. If somebody in the family has the virus, we give it as well for the members of the family. So we don't know. We just have to wait and see.
I hear that zinc is good to take to boost your immune system. Is there anything other that people have access to that they can decrease their chances of getting it?
Well, the important thing, you have to be healthy. Stay healthy. Vitamins are always important. Vitamin, all antioxidant, vitamin A, C, and E. Those are all good. Yeah, you're gonna eat healthy, and that's the bottom line. Yeah, there is some observations that they found out while from these people who are being sick with COVID-19. For example, they found out people who were on vitamin D did better. They found out people who were taking antihistamine too, like Zantac and famotidine, did better. Those are all observations. Are they 100%? Who knows? Yes, there is some medications that's used for autoimmune, like lupus, Plaquenil, or hydroxychloroquine with the Zithromax were given in Europe, in Paris, seem to show some improvement. Nobody knows, but there is no experimental or trials on this medication that's 100% safer for the patients. You know, you don't want to give somebody Plaquenil and it gets all the side effects for the eyes, for the heart. You don't want to do that. But they notice, there's also observations. People on this did better. Is that really real? We don't know. As I told you, vitamin D, they said, okay, anybody with vitamin D or zinc, like you said, or antioxidant, people did better. So really, there's not really science-based evidence that these things worked. But it's all observations. There's no testing done yet.
Yes,
but again,
yeah, to add to that, yeah, we don't have randomized control trials. That's the highest level of evidence to say that something will work. So we don't have that for any of these treatments. And as Dr. Mallouk was saying, that's observational. So to add along to that, you know, another question is if I'm taking ibuprofen, meloxicam, Advil, you know, is that going to make it worse for me to get the virus? So that's also observational. We do not have any randomized control trials to say that if you're on those medicines, that you're more likely to get the virus.
Okay. You said we just hit phase 2 at this point, right? The state, our area, not the state, was about our area. What's next? Like, so not all businesses now are open, but what's next for us, and when do we get there? As far as what do we need to reach for us to get to the next phase?
So,
it's basically what?
You know, we're going into different phases. It's 1, 2, 3, and 4. So we need guidance from the governor. So if things go well in phase 2, you know, over the next 14 days, minimum of 14 days, if the cases stay down and all the different criteria by the governor, then we go into phase 3. Okay, so phase 3 includes restaurants and food services. And there's some guidelines for phase 3. So we go to 3, if things well in phase 3, and you go to phase 4, which extends to arts, entertainments, recreation. So that's the next step. So right now, you know, we want to focus on phase 2. We keep with the precautions, keep the cases down, and then we would get guidance for the next.
And if we don't follow the protocol in phase 2 and we fail, we have to go back to phase 1. That's how we're gonna do it. You stop and go back.
If we get more cases within the next few days, between the 14 days period, and then we go back to phase 1. Is that the
That's
idea?
what they're saying. They have to back off a little bit, you know. And it's basically, it's all about, I don't think you heard them flatten the curve. You know, they want the curve to be flattened. The reason you don't want to see peak. Let's see if we have in an ICU in the hospital, maybe there's like 21 rooms in ICU, okay? And if it's flattened, meaning we're getting maybe 50% of people are sick, so we have enough rooms for them. We don't want to have to see the peak, like all of a sudden we have 100 with COVID-19, and we don't have enough place for them. So that's what the scary part, that's what they tell you, flatten the curve. That's what they meant. They want us, it's okay to have people coming with COVID, but not as an extreme where you have no room for them. If you have only 1 case or 2 cases, we can handle. But we have 100, no, we can't. So that's, they don't like the peak, they want flat the curve.
Mike, do you have a question?
Oh yeah. Do you think that the increase of protesting and rioting going on right now are setting us back increasing the chances of more people getting the virus?
Possibly. If somebody is sick around, yes. The good things I've seen all of them wearing masks. That's a good thing. They are not doing 6 feet. You know what? There is chance. There is chance of spreading it if somebody has it. Yes. I mean, I see them. They're close to each other. Yes. So they are not following the protocol. I think more likely they may get it and spread it.
Well, I wish they could, do the protest virtually. Maybe if they could do it over Zoom.
Zoom it.
So, it's we still have to keep with the precautions. So if you don't keep the distance, you don't have your mask on, you have large gatherings. This is how the virus spreads. So, are you going to have people, violating some of those precautions? Certainly. So we still want to keep with those safety precautions, and maybe we'll find, other creative ways to still, get the point across, protest, do other avenues.
So summer is here, almost here now. People gonna want to go out, want to go vacationing. What's your advice as far as that goes? Do you think people should still be able to travel, or is it something that we need to keep at home as much as we can? What are your advices to people that want to do that?
Well, as of now, the protocol is no more than 10 people in gathering. No more than 10 people. The nature is always the mask, as I told you, and also always the 6 feet. But if you are like with your wife or your family, I mean, you live in the same household, it doesn't have to be 6 feet, because it's your family. You are in the house, you're with them like that. But just be safe, If you're outdoor, I think I definitely recommend people to go outdoor and enjoy the nature and do whatever they like to do. You just do it with precaution. Always mask. If somebody, a friend you saw on the streets while you're walking, 6 feet. Hi, how you doing? When it's okay to sit and talk to them.
So you want to be smart about this, and the best cure is prevention. So if you're traveling, and people are going to be traveling, they're going to be outside moving around. So we keep the precautions, and you want to check with your corporation business that you're working with. So for example, with our RNet system, we have different rules and regulations. So if people travel, depends where you travel. If it's a hot spot, the CDC describes different hot spots. So if you're going to one of those regions, you may have to self-quarantine for 14 days. Still take caution on the flights, wear a mask. Some airlines actually make you sign that if you are flying from New York or somewhere else, that you would self-quarantine for 14 days. So check with your employer and, be smart, take all the precautions, and be safe for your safety and for other people's safety.
Mike, do you have any other questions?
I'm all set.
I guess we can see if anything you want to say to people now in the area, just as a last thing to say before the episode ends. Any advices? Anything you want to share with the people?
Yeah. So just to summarize, you want to be safe, take all the precautions, and keep 4 things in mind. Okay, things that we have already talked about. 1, keeping your distance 6 feet or 2 meters. Have a face covering, wear masks in places. Good hand hygiene. So washing your hands with soap and water. It doesn't have to be bacterial, antibacterial. It's a virus. So water or with all. And if you have any symptoms, talk to your doctor. aspirant, they can let you know where they're getting tested nearby. And as we go through the different phases, people, still want to remind people that virus is still here and alive. It's there. So now is not the time to relax. Now is the time to keep safe and be smart. You can still go ahead with the new normalcy, new type of normal, and still carry on your daily activities and keep your distance. And as we go forward, hopefully we can go through all the phases within the minimum period of time.
Definitely agree with Dr. Sharma. Together as a community, we can fight this virus. We just follow the protocols that was given by CDS, by our governor, by our community. And hopefully someday we all can be free and we won't have the masks. But like what he said, we have to be smart. It's a virus. We don't know what's the outcome. If it's gonna come back or not, we don't know. We just have to be safe. And we can do it.
So yeah, thank you. Be safe and be smart.
Thank you guys for joining us. I really appreciate it. Taking the
Definitely
time to
thank you for
ask
having
some
us.
questions. Absolutely.
Thank you for having us.
I'm sure people will appreciate you guys taking the time to answer some questions and just give people comfort. To know that we're doing a good job by following rules is a great thing, and hopefully within the next few months things will get better. It'll be just a big nightmare.
Thank you. Have a nice weekend, guys.
Thank you.
Thank you.
So long. Bye bye. Yeah. So long. Yeah.
Enjoy the
So
beach.
long. So long.